severe infections or not. There are expert opinions from various stalwarts, especially Dr. Khilnani, which has also he has also emphasized the prevention strategies for control of Omicron variant. And then there is a concern as far even if people are vaccinated, it is affecting individuals, and it is 2 to 3 times more contagious than Delta variant, and it has led to severe outbreaks in the UK and USA, even in vaccinated individuals. But those who are not vaccinated, then there in these individuals the mortality is very high. So as far as the symptomatology is concerned, the symptoms are little different, but sometimes the symptoms are also coexist in different variants are also causing infections together. So that's why the symptomatology is also variable. So as we know that in India, we have achieved zero positivity. Some patients were asymptomatic. Many individuals have been asymptomatic during last pandemic, and they have led to spread of infections, and probably people have achieved natural immunity. But rather than only, it's not just the natural immunity, but vaccination has proven effective. Most of the children in India are not vaccinated, so it is likely to affect these children, and that's why vaccination of children is very essential. So as we know that we have one advantage, as we know Omicron is associated with rapid transmissibility, but it is still a weak virus, and the severity of infections will be very mild compared to the previous one. So how are we responding as far as the India is concerned? So we have done very well. Indian government is monitoring the situation closely, and we have deployed diagnostic modalities, and we have carried out genomic surveillance. In India, we have collected our own data, and then epidemiological characteristics, and the development of the therapeutics will be advocated very soon. So does the existing vaccine work against Omicron? We need to have our own data. At present, we don't have any evidence that the vaccines are protecting us completely. No, the vaccine protection is only by the antibodies, and it is basically through the cellular immunity. But the cell-mediated immunity is going to be relatively preserved, and then vaccines are expected to offer protection against the severe disease, and the vaccination will be very crucial. So that's why we should get vaccinated as far as possible. As far as WHO recommendations are concerned, WHO also has given a lot of emphasis on the vaccination, and then the vaccines are very effective, but we still need to have our own data. As we know that this variant with those individuals who have received 2 shots of vaccine, they are not protected that well compared to those individuals who have got 2 shots and boosters. Okay, any individual who has got third dose of vaccine, they are 25 times more protected against Omicron. And then UK study also has shown that the boosters are more effective against Omicron variant. And then in India, we have seen the emerging hybrid immunity. So hybrid immunity means we have got immunity against COVID-19 infection. We have got immunity against other viral infections also. And then this pandemic has revealed a form of a super immune response among some individuals, those who are infected with virus and vaccinated. So basically, this is considering India. as you know, it was expected that India being so much populated, the mortality will be very high and all that. But that was proven wrong. Okay, the mortality was not that high. Individuals in India, there is definitely a development of herd immunity, and majority of the people are vaccinated probably. So that's why the infectivity and the severity of infections is very high. In those countries where the vaccination rate is very less, like USA and UK, probably there we have seen the people are not going for vaccination, and uh, there is a visible difference as far as the mortality is concerned. 80% of the individuals who are not vaccinated are hospitalized, right, with ICU admissions and going on ventilators. So yes, vaccination is very, very helpful in curbing the viral infection. And then, as we know that there was a small study where they have done a study on almost 30 participants, and they have found out that 77% of the individuals had mild infections with the COVID-19 Omicron virus. And then 17% of the individuals had moderate disease, and 7% individuals only developed severe disease. Okay, and then 80% of those individuals had 30% neutralizing antibody response. And then the different companies also have come up with their agenda, and Moderna also says that the booster dose of current COVID-19 vaccine is quite effective against Omicron variant. And then Moderna vaccine is associated with improved antibody response with Omicron. Our ICMR data is also come up, and it has shown that probably Covishield vaccine is also associated with control of infection. And then the data was published on 8th of December 2021, and it has shown that 3 doses of Pfizer vaccine is also able to neutralize COVID variant Omicron. And then that's why, I mean, probably in USA, New York, and other places, the third dose of the booster dose was given to many individuals. mRNA-based COVID-19 vaccines booster induced neutralizing immunity against SARS-CoV-19 infection. So this is about the different mutations that we have seen. The infectivity with initial variants, the infectivity was around 1 or 2 times, but with the Delta, the infectivity was 2 times, and with Omicron, the infectivity is 4 times. So as we know that there are 34 mutations, but all these mutations are quite mild.